Leader Harry Reid today put the option in public option. Reid says the Senate version of health care reform will include government-provided insurance coverage, but that states will have a choice about whether to participate. Correspondent Shannon Bream explains.
The Senate's health care reform plan, complete with a government-run public option that states will be allowed to opt out of, is on its way to the Congressional Budget Office to get an official price tag.
All the national polls show a wide majority of Americans support the public option. I think it's important that the matter that we work on from the Senate have a public option in it.
The White House today praised the inclusion of a public option in the Senate plan, and key Democrats have repeatedly argued that a government-run option is necessary in order to challenge the private insurers they've termed villains.
I'm very pleased that our chair of our caucus, Democratic Congressional Campaign Committee, and a member of the leadership will be talking too about the immoral profits being made by the insurance industry.
I don't think we should be crying great big tears about the insurance industry. There is no business in America that makes more money than the insurance industry.
But that's not what the numbers show. Network and communications equipment tops the Fortune 500 most profitable industries list with a profit margin of 20.4%. Way down the list behind railroads, food services, and electronics is health insurance at number 35 with a profit margin of just 2.2%. Still, leading Democrats believe the public option with the compromise of a state opt-out plan is the best solution. But skeptics remain, including Republican Senator Lamar Alexander, who says a similar opt-out provision related to Medicaid has not been a success.
But it's not realistic to say that the states can opt out of the Medicaid program for low-income Americans, and I suppose it might not be realistic, therefore, to say that the states would really be able to opt out of a new government option program.
Because health care is sure to be a top issue in the 2010 midterm elections, a number of Democrats are also pushing to see that the benefits of any reform plan would begin rolling out next year, rather than in 2013, as is currently the case under most proposals. Without that change, Republicans would be free to emphasize the hefty price tag Americans are shouldering while getting nothing in return. In Washington, Shannon Bream, Fox News.
Senior political analyst Brit Hume is here tonight with some insights into why perhaps the reform debate has been so difficult. Good evening, Brit.
Hi, Brett. If you're wondering why President Obama and his party are finding health care reform and much of the rest of his agenda such heavy lifting, look no farther than a Gallup poll out today. It finds 40% of Americans call themselves conservatives, 36% said they're moderate, and only 20% say they're liberal. That's no doubt why liberals today prefer to call themselves progressives. The findings are of a piece with a poll taken on Election Day last year, in which people were asked to rate themselves on a scale of 1 to 9, with 1 being far left, 9 being far right. It averaged out to 5.88, the answers did, which is clearly center-right. The president, though, has sought to enact an agenda which is clearly left of center. That same Election Day poll also asked people their top priority issue. 44% said the economy. Only 5%, as you can see, said health care reform. Even after all the talk about it, health care still ranks far below the economy in current polling. After accepting what millions saw as a bloated stimulus bill to revive the economy, the president has spent much more time and effort on health care reform, even as the unemployment rate has climbed, far past what his advisors said it would be. Making great big changes on an issue as big as health care was never going to be easy, but especially not with the left-of-center program for a right-of-center country, a country focused on an entirely different issue. Brett?
Brett, we know very little about this government-run insurance option that Senator Reid talked about today that states could opt out of. But what does this tell us about the politics here?
Well, we know, and Senator Reid acknowledged, that this loses the vote of Olympia Snowe, the only Republican in the Senate so far to vote for any version of this bill. She voted for it in the Senate Finance Committee. So far as we know, she was the only potential Republican vote in the Senate. There will be few, if any, Republican votes in the House for this, either way, any way it goes. So it looks as if this bill is going to be passed possibly by Democratic votes only. Now, they may be able to do that, but it never before in our history that I can remember has anything of this magnitude passed on an entirely partisan vote. There have been massive bipartisan votes for things like the creation of Medicare, for example, and so on. The political risk is fairly great in doing that because if it doesn't go well, there's nobody to blame but one party.
Okay, Britt, thanks.